do the best for. The RECA conference was awesome for us. We were able to compete here at International because of what we've done at Virginia State. We're able to be first place at Virginia State, and as a result, Virginia Association of Volunteer Rescue Squads sponsored Loud and Rescue to come out here for us to compete internationally. It has really helped us because it allows us to see on a very broad exposure across the country and internationally what types of people are involved in EMS and what types of techniques they're using. So it was a major learning experience for us.
RECA also hosts a competition for the best EMS performance. Having covered BLS last month, let's take a look at an advanced life support scenario.
Well done, BSI. All right, where's our victim?
The team queries a competition official for patient information as if the team had discovered it for themselves. Also, team members announce and simulate various procedures as if they were performing them. In this scenario, a worker has fallen from a ladder at a construction scene.
All right, we've got to get Jim in there. Jim, come grab C-spine for us real quick.
Got it.
All right, anything... Hello, is he breathing? Here. Is he breathing?
Is it secured and out of the way?
Do I hear any breath?
Yes.
How many breaths a minute? Okay, what am I on the ground here?
That's
Concrete?
all it's construction debris.
Okay, I have one patient.
One patient.
Okay, any bystanders around that can tell me what happened?
Not right at the time. No.
How many? I got,
What's above me?
6 breaths a minute?
It's a housing
Okay, I'm gonna
construction.
get airway. So nothing's gonna come down on top of me?
Nope.
Okay.
He has a piece
Right.
of
We are bagging
rebar that has
once
gone
every 5
through
seconds.
his
Walking
face.
for adequate chest
He has
compression,
rebar
15
in
liters
his
per minute.
face.
Through his face, has gone through the left side, has come out the right side.
Is this underneath him?
It's all, whatever you can move, you can move.
Anything on the head, C-spine?
An inline, nope, it's all good, it's all negative.
Anything on the hips?
Intact.
Is he responding to me at all? Is he
No
responding to pain?
response at all. No
Any types
response
of
at all.
any types of fractures?
Not that's evident.
Oh, what's in his stomach?
There you go.
Oh, that's nice. We have a piece of rebar in his stomach. Okay. Is this gonna fit with the rebar that's in his face?
No, the C-collar will not fit.
Okay.
All right. What's his pulse rate doing?
His pulse rate is very weak, very fast.
How's his airway? We're bagging once every 5 seconds, 15 liters O2.
You're bagging him right now. He's assisted.
Okay. Still got a patent airway. How's my pulse?
It is to now, for now.
Pulses?
Pulse is still very weak, very fast.
All right.
All right,
Is
bleeding.
the back cleared?
Yes,
You need to
back
get rolled
is
over on the
clear.
backboard.
I've got pressure dressing, tourniquet wrapped around this
And,
evisceration abdomen.
and get on the other side.
Okay, hang on.
Board up.
Anything here on his neck? Anything else on his chest?
All right, whenever
Clear.
y'all are ready.
Clear.
Breath
You got it.
sounds.
Bagging,
Bagging.
bagging,
Bagging.
Okay.
bagging.
Bagging.
He is clear all the way around.
All
All
right.
right,
Ready?
heart sounds normal.
Let's roll it. We need to roll it.
There is heart sounds. You cannot hear heart sounds.
Ready?
It's very rapid.
All right,
Okay.
ready? One, on your count, Jim.
1, 2, 3.
Do it now. Go ahead and slide it in.
All right, this shirt is off. Is this,
Exposed as necessary. We need to move him
Go
up.
over and up.
Ready?
1,
One.
2, 3. Up and back down.
Ready on your count.
1, 2, 3.
This
All right,
is
we're
what
good.
his airway looks like.
Okay, so I can let
All
go
right.
of this
Can
C-spine
you
and all
intubate
that
that?
one.
yep, so you take care of this, track it down, check his heart sounds. Jim,
What?
need you to
You
finish
still have
up.
C-spine, right?
Yeah, got
Okay,
C-spine
it
over
is
here.
very hard to bag because of the rebar. You're not getting a good seal.
All
Not
right, you
getting
need
a
to
good
get him
seal.
tubed, Dan.
Okay, I will.
All
All right, check his
and
lungs and airways. Excuse me, out of the way.
okay. There you go. You got airway. You're gonna take airway or
He's gonna take
C-spine with
C-spine.
All
your
right, we're
nose.
gonna need to get an IV, normal saline, check for
All
fluid,
right.
full
And
bottle,
as soon as
connect.
you get,
Airway.
as soon as you take
Three-way
C-spine and
connection.
start the airway, Jim can hold pressure here, and I'll get straps as well, and I'll start the IV.
Okay. Got it.
Uh-huh. All right. We need to set up vitals if you can, Jim.
Any other injuries on the legs?
No, legs are clear.
Okay.
All right,
Arms.
Clear.
What's my pulse ox?
Okay.
Okay, nothing here on the face, jaw,
Rebar's through here and through
Okay.
here.
There's
trach
pulse
is
ox.
midline,
Trachea's midline and
carotids are okay.
they're flat.
Okay, I'm just checking one at a time. Nothing here on the face,
Nope.
pupils,
They're equal.
You gonna take that down?
Yep.
all right. No teeth are intact,
Yes, teeth are intact.
Bleeding's controlled.
Is it?
Yes, bleeding is slowing down.
Okay.
Slowing down or controlled?
Slowing down.
All right, we've got it fully taped.
Okay.
We apply more
Put a
dressing.
bag on him because I need
Is
to
bleeding
lubricate this
controlled
'cause
with
this will not
additional
go in like
dressing?
this.
He's still breathing.
Pulse ox is applied to finger.
His pulse ox is at 90.
All right, let's get some
All right.
O2.
Got the bag. It's at 15 LPMs.
Thank you.
Bagging as necessary
Yep.
between intubation.
Your blood pressure is 70 or 60 PELP, thank you.
60 over P.
All right. Starting a
It's cold.
large bore IV. Fine. The tourniquet. Do you want me to actually apply the tourniquet? Ugh.
Yep, and just go ahead and tape your catheter down.
Okay.
You're still not feeling a pulse, it's still too rapid and too weak.
Too rapid and too weak to get a
Get the
pulse.
IV
I'm
established.
trying.
Thank you. What's my heart rate?
It's too fast to count.
Okay, I'm not in. Because I would be checking lung sounds.
Very good. Then they are absent, or, yeah,
All
they're
right.
absent.
Find me a heart monitor, put them on it, please.
Do we have a heart monitor?
IV's
here?
established. Fluid's running good. We add open bolus and the left AC.
Okay, we have a heart monitor.
All right, monitor's on. All
Throw my
right,
sharps away.
SVT.
monitor is showing a PSVT at 176.
How
We have the
much?
500 cc fluid bolus.
Yes, it's running.
Is that infused?
Do we have it?
Yes, your
All right.
500 is in.
Recheck my heart rate.
All right.
Still showing 176.
Okay.
Amiodarone, 150.
Amiodarone, 150 milligrams. Hook it in there and push as fast as you can go.
Here you go,
Jan.
Dan.
Okay.
Dan.
For
Amiodarone's
SVT
in.
type rhythm.
What else?
Still no response.
What else you
All
want?
right,
Do you
let's
have
get in.
any signs of medical alert, any medical
No
problems?
medical alert tape.
Does anybody here know him? Do they know any allergies, medications?
Need to get a second
See what
dose of
happened?
amiodarone?
We have him strapped to the
All right.
board.
All right, you ready to get him in the ambulance?
Yes.
All right, we're moving him to the ambulance.
Here's your bystander. Here's the guy
Oh,
that called. He
hey,
just got back.
He was working on the ladder,
Uh-huh.
then
How-
next, he didn't feel so good, then he collapsed.
How do you mean didn't feel good? Nausea?
Second
vomiting?
amiodarone
I don't
in.
know. He didn't
You
feel
just
so
felt, did
good.
you see what he
You
felt on?
give first 6 milligrams of amiodarone, then 12
And-
milligrams. Okay.
Okay. All right, we're getting him in the back of the ambulance right now. We've got him in the back of the ambulance headed to the hospital. We're rechecking all of our interventions.
He,
Doing
did
another
he
set
eat
of vitals?
today? Has
Still
he been
has
outside in the
pulses
heat?
He
I
does
don't
not have pulses in the feet.
I don't
No
know.
pulses in the feet.
No
Do you
pulses
want
in the
more
feet.
fluid? He's no pulses in the feet.
Any signs of head injury, ICP?
Do we see any like bruising?
There's no bruising, there's no sign of
Raccoon
head
eyes?
injury.
All right.
My abdomen, is it still soft or is it distended? Is that controlled, that impaled object controlled?
Yes, we've got that steady right there.
My lung
Do you
sounds
know if he
still
has
good?
any allergies to medications? Does he take any meds?
Doesn't
Do you know
know
anything
anything.
like that?
Does
Okay.
he take any drugs, narcotics?
Do you know his name?
No.
What's his name?
I don't know.
You don't know his name? Okay.
Unknown, all of that unknown.
Do you want anything else done?
Okay, we need to get him warmed up, get him wrapped up, elevate his feet mildly, mild reverse
You know,
Trendelenburg.
we need to.
We're gonna put that in
We
there,
can
we're
wrap
gonna
it.
hook it up to a
Pulses,
drip,
we can
label
wrap
my
it.
bag, and then I'm gonna hang it, to titrate towards his
Respirations.
blood pressure. I'm gonna start at
Still being
5.
assisted.
I'm gonna do my
Okay.
dopamine at 5 mics per kilogram at this point, which roughly is he's, I don't know, 180 pounds.
Blood
Dopamine's
pressure.
in.
Okay, in through there, it's labeled, it's hanging, and then we're gonna titrate towards his blood pressure, checking the
good?
pressure every 5 minutes.
Okay.
Blood
Okay.
pressure.
Is still 70, it's actually, his pressure now is 60 by palpation.
Okay, we need to
His
get,
heart rate is still 170 on the monitor.
he's in hypovolemic shock, cardiac shock. Any signs of a cardiac tamponade at all, or decompressed chest?
Nope.
Anything
All
else
right,
we do?
we've got dopamine going, we've got fluids going, we've got a second IV that needs to be established to repeat the IVs. Abdominal trauma, pelvic is intact, our decap BTLS head to toe is fine. Oxygen is still good, good hypovolemia, good. No
He's
time.
still bagging, he's still only satting at 95%.
Okay,
Okay, we check everything.
just continue
Good
on,
to go.
notify the
No
hospital, give a core
JVD.
report, tell them coming in with a roughly 20-ish-year-old white male who has
Any
fell
fluid from the
roughly
ears and
about
eyes?
8 feet from the top
No
of the ceiling. He's
deformities?
unconscious, unresponsive,
Anything in the
medical
leg?
history unknown. Blood pressure is now 60 by palp.
Do you have good
Heart rate
pulses?
176.
No pulses in the feet.
Heart rate's 176. So
Fluid
there's,
check, alcohol.
he'd been eating
Prep,
and drinking fine,
stick.
according to the friends. The
blood.
possibility of heat exhaustion outside.
What's my fluid check?
Fluid bolus.
Blood sugar is 100.
Okay,
Still no
100.
pulses in the feet?
Still no pulses in the feet.
No other damage on the legs?
Nope.
We still got him covered for shock, all that good stuff. You ready?
20 minutes.
Yep. Tyler.
What a mess.
Back it up, Dave. Nice job.
The Transportation Emergency Resource Center, TERC, does for vehicle extrication what Eureka does for rope rescue. A regional TERC competition was also held in Seattle. Let's go have a look. Some of the best vehicle extrication teams in the West Coast are competing. Scenarios are set up for the teams, who then see them for the first time. Coming up is a limited scenario where live patients are used. However, hydraulic tools may not be used. Let's observe the team from Lakewood Fire Department, Lakewood, Washington, as they arrive on scene.
Car crash, heavy intrusion, one car against the barrier.
I say!
Yes!
One patient, driver's side, gold car!
Patient, driver's side. Medic's got a patient, driver's side. Medic's on the way!
This is Lakewood Fire Department, Lakewood, Washington. They do have a car up on another car with a car in a Jersey barrier, patient being in the bottom car. Right now their objective is to stabilize the vehicle, making sure that they fill any voids in between the Jersey barrier and the car, make sure the top car gets stabilized as best as possible. Their plan now, they have a plan A and a plan B. It's always best to get your plan A right off the bat so the team knows what's going on. They did their inner and outer circle. They found the patient, and now they're just formulating the plan. And I heard them say they're going to cut the roof off and get the patient out after the roof is cut. Medic's job is to make sure that the patient is awake, alert, and oriented. For this is the limited scenario, so there is a live patient inside. And their objective is, as a medic, is to make sure that they look straight ahead, not moving their head. Patient's safety and security is pretty much the first priority on all these scenarios. They're going ahead and take the Rescue 42 struts. Looks like they're going to put it underneath the wheel well and get it done that way. They're taking off all of the stems, keeping the car secure to the floor as well. The objective of the Rescue 42s is to keep a 45-degree angle, keeping the base of the 42s on the ground. So they're going to want to secure it to either each other or something, as if they have straps going off to the sides. But it's just making sure that the car will stay in place. The IC's job is to just keep moving around. They're going to get scored on how well they formulate their plan, how well they communicate with the medic, making sure that the patient is kept in mind through the whole scenario as well. And he's the ultimate safety officer, just doing the 360s and making sure that everything stays nice and secure. Team members, as they're working on the ground, are advised to keep one knee off the ground at all times. It's almost dinged if they do get two knees on the ground, that way that they're in the collapse zone especially, but they always have a way to rapidly get out. Once the vehicle's secure as it is now, the medic would be able to go ahead and make patient contact and secure inline manual stabilization. Some teams like to have a medic and a medic helper, so that way the medic can stay in the front with the patient and do a full primary, secondary survey that scores extra points.
When we get a chance, we need to look at batteries and airbags, make sure her car's
IC just did his great job making sure that all vehicles are shut off, secured with the emergency brakes, and that all SRS devices, if they have them, have or have not been deployed. It's something that should be communicated by either the interior person, like the medic helper, or one of the team